So last time we have discussed about the pathology of musculoskeletal system. There, the important disease conditions of the muscles and some part of the skeletal system also we have discussed. So last part of this skeletal system, that is about the fracture, bone fracture. Okay, that is very important. So far your examination is also concerned. So just a minute. Some people still. So all of you might have heard about fracture. Okay. So whenever means we the people or the animal also, in case of these animals also, when bone fracture, any fracture occurs, then we used to have very much painful and we cannot move and we cannot utilize that very particular limb or hand. Like, okay, so what is fracture? So if you are asked what is fracture, it is nothing but it is a break in the continuity of the bone due to injury or trauma, like accident and all these things, sudden falling down on the ground, or like accidental and this like injuries and all this, right? So when there is a break, just maybe a simple break also in the continuity of the bone, it is known as fracture. So it may be simple or compound. Okay, means simple means when the fracture is inside the this body itself, and only one break is there, a single break is there, and the broken end of the bone is not coming out of the body on the of this body surface. So those conditions, it is known as simple. Then compound means fractures may be multiple, or means mainly means when the broken end of the bone used to be coming out of the body. Okay, means on the body, out of the body surface on the. So that is compound. Then means when we are talking about this healing, bone fracture of course will discuss physiological and their changes and all these things. Then it used to heal up and we have to go for this surgical operation or like some other these techniques for management of the fractures and all these things. So it should be repaired, means healing should take place. Okay, so healing of this fracture occurs by the reunion of the two broken ends or maybe multiple. Okay, and means through development and the proliferation of some cells like newly formed cells known as fibroblasts, angioblasts, osteoid tissue, and infiltration of calcium salts. This way means healing of the fracture bone this used to this repair or this taken up. Okay, just a minute. Someone is still waiting. And so far the etiology and the causes are concerned mainly trauma, these injuries, mainly like as in case of this accident, automobile accidents is very commonly, or sudden fall down, accidentally on the, this ground. Mainly means in bathroom, very commonly people used to fall down and used to have the problem of this fracture, right? So when we are talking about this, means the changes, what kind of these changes used to be there in case of this bone fracture. So it can be identified by the break in the bones, means maybe a very simple break, linear, or maybe in two pieces. Okay, only two pieces, three pieces, four, like this multiple also maybe, a single also maybe. So when these breaks are there, any break is there in the bone, so means this is such kind of this break which should be visible in the bone. And healing of this fracture, when it is taking up, this is starting the healing process, as I have already mentioned also, there will be starting the development of this callus, newly formed tissue, okay, callus at the site of the reunion of the breaks of the two bones, or the bone this fragments, okay. And this kind of this callus, newly formed tissue, okay, so this may be very soft or even may be hard. The part of the this fracture, this used to be this initially when this healing starts and all. So it's just kind of this newly formed tissue containing fibroblasts, angioblasts, bony newly born tissue, this osteo tissue, and with infiltration, means deposition of this calcium salt, calcium, okay, for hardening of this the bone and all, right. And you used to, we people, also like animal also, means feel pain at the site, and even we cannot utilize that limb or that leg or hand and this hand and all this whenever the fracture used to be there, very much painful, okay. And if you make section at the side of this fractures bone, and this bone fracture side and this, so under the this microscopic and this examination, if you collect the tissue and make this section and scan it, then you will find those cells like this newly formed fibrous connective tissue, what we call fibroblasts, newly formed this vessels known as angioblast, and the metaplastic changes of the connective tissue to osteo tissue, means transformation of the connective tissue to the this bony tissue, okay. And in between this, means you will find deposition of this calcium salts in the osteo tissue, okay. So let me show you some types of this bone fractures. So simple fracture, as I have already mentioned, involves a very single fracture, maybe line through a bone, means there is no any opening of this overlying skin. Then closed fracture means which have no opening to outside, and that there is no any break in the skin along with the fracture, that is known as closed fracture. Of course it is under simple fracture. Then open fracture, which communicates with the outside, likely to become infected, means when the broken end of the bone is coming out of the body or the overlying skin, and it is exposed to the outside environment, so it is having very much chance for getting infection, right. Then green stick fracture. So the name green stick fracture, when you are bending, trying to break a green stick, okay, means you just go on bending. At last, one side of the this green stick, the stick, this will showing the break, this, okay, only one side, not both side. So this way, when a bone, a long bone, for example, it is showing a break on one side only. By showing bending later on, it is showing a break on one side, not the both side. Okay, so this kind of this fracture is known as green stick fracture, and it may be this commonly found as in case of these young dogs when the bone is a little bit soft. It is not that much hard as in case of the other one, right? Then fissure fractures, which are very small, long cracks in the bone. I'm showing all the these photographs, pictures also for this different type of these fractures. You just go through it. Okay. Then complete fracture, where the whole, where total and complete disruption of the bone has occurred. Okay. This complete disruption of the bone, totally means it is disrupted. Okay. Then transverse or oblique or spiral fracture. That is, means the fracture is, at what angle of the bone is broken. That is, this different type of, this fracture known as transverse or oblique or spiral fracture. Then this comminuted fracture, when the fragments or the splinters occur at the part of the fracture. That means the bone has been broken into many pieces, into fragments. Okay, multiple type of this fracture. I mean, and so many these fragments and these splinters, or I mean this bone pieces are there and this broken into pieces, like, so that is known as comminuted fracture. And these are some more on this picture showing this different type of this fracture. Okay, please go through it. Then some more on this, I'm giving some more type of these fractures. Then those are multiple fractures. Okay, where 3 or more lines of these fractures or more pieces are present in a fracture site, like this comminuted type of this fracture. Then avulsion fracture, where a piece of bone is broken at the site of a muscle, ligament, or tendinous attachment. That type of this fracture is known as avulsion fracture. Then impaction fracture, where ends of the fractures are pushed and driven together. Means one piece on one end of the bone is inserted or pushed into, driven into the another this bone. Okay, that type of this fracture is known as impaction fracture. Then physical fractures, which occurs at a line or point of growth, and those are very much serious type of these fractures. Then condylar fracture, those fractures between the condyles, and the condyles, condyles, you might have learned in anatomy, I think. Then rounded areas at the end of some long bones. Okay, so those type of this fracture are known as condylar fracture, involving the condyles, of course, in between the condyles. Okay, then stable fractures are those which lock and are not too movable. Okay, means after the fracture and all these things, they have been locked and it is very difficult to this move. Okay, so stable fracture. Then unstable fractures are those where the pieces of the bones, fragment and these fractured bones, do not naturally hold together, means one another. Okay, then compound fracture is a fracture in which there is an associated open wound, as I have already mentioned, and which leads to directly to this broken bone. Means when the broken end of the bone is coming out of the body on the overlying skin and exposed to the environment. Okay, I mean this type of this open wound. Okay, and then the fragment on the bone and broken bone end used to be coming out of the body on the overlying surface and this skin and all. Then this kind of this fracture is known as compound fracture. Okay, and then linear fracture, where this there is a fragment. The breakage or the break is in a lengthwise linear form, in a line. Just means they have not been. The bones have not been broken into pieces. Only linear in a line form, and this crack is there. Okay, that is linear fracture. Then articular fracture, where the joint surface of the bone is involved. The this articular means the joint, involving the joint. Okay, articulitis means you might have heard and the inflammation of the joint, osteoarticulitis, right? Osteoarthritis, that way. So articular fracture is where the fracture is involving the joint. Okay, that is very serious type of course. Then now coming to the healing and this repairing of this bone fracture. This is important. So there are few events which occurs during the process of this bone healing, and this is more or less same, of course, as what we have learned in this healing in inflammation. Already wound injury, wound healing, we have learned. Okay, the only thing is that here it is about the bone tissue. That is normally in other and this body tissues and all this, but here mostly when we are talking about the bone fractures involving the bone. Okay, so just immediately, just after the bone fracture, whenever means we have fracture. Okay, so from that fragmented bone, bone into pieces or some severance, nearby the blood vessels used to be severe, means torn. From that, blood used to be coming out. That means hemorrhage will be there, with subsequent accumulation of this blood in that side, at the side of this, fracture. So that is known as hematoma formation. So first step is your hematoma formation. With this, what you will find is that, I mean, the blood vessels just around this, at this site, used to be torn, severe, severance will be there. So blood will be coming out, and the blood will be accumulated here at the site of this fracture. So this accumulation of the blood at the side of this tissue, outside this bone, of course, around surrounding the bone fragment, this. So that is known as hematoma formation. In the subcutaneous tissue also, in the ear, this accumulation of blood, you might have heard about the hematoma already, right? So this way, this hematoma formation used to be there. And in this site, what you will find is that the bone fragments, means osteocytes, used to be, this destroying, and they are necrosed, and this is nothing but means due to hypoxia, because this these bones, bony tissues and all this, they are not getting the this oxygen as well as the nutrient through the blood vessel, because the blood vessel is also already torn. So blood has been leaked out and going towards the outside and accumulating there at the site of this fracture. Okay, then next step is inflammatory response. So as we have already learned about inflammation. Okay, so whenever anything etiological, as in any injury, anything is happen in the body, this is about a fragment, this fracture. This is also one kind of this inflammatory reaction. There, this physically means your bone fragment is there, fracture is there. So this is also one kind of the immune system. Your immune system will react to this, will come to overcome, this, or to heal this, fragments and all these things. So that's why this hematoma formation, the first step used to be followed by inflammatory response, in which so many inflammatory cells and chemicals like prostaglandins, cytokines, growth factors and all, they are also released with formation of fibrin mesh this site. Okay, so this is inflammatory response, means from your immune system, from your body, they will just try to heal up the fragments or the fracture in the. So this inflammatory response is a positive response, right? After that, means next step, they will start forming the newly formed tissues. I have already mentioned about the fibroblasts, angioblasts, and all these things. Means newly formed fibrous connective tissue, what we call fibroblasts, and the newly formed vessels, this angioblasts. Okay, and the mesenchymal cells, maybe the osteoid cell and this tissue, or this, as I said, this muscular tissue and all. So this way, this newly formed this structure, tissue, is what we call, and it is known as granulation tissue. So next, third step is your granulation tissue formation. So this is already means in the healing, healing means normal is of the injury, and this healing, and we have already learned in this inflammation chapter. So this is involving the bone fracture only. So this way, granulation tissue formation at the site of this bone involving the this fibroblasts, angioblasts, mesenchymal cells, as well as the osteocytes, on this bony tissue cells, and this some newly formed capillaries, and this this blood vessels and all these things, it will be there. Then it will be followed by what we call callus formation. In this case, what happens is that the bone reabsorption is followed by formation of cartilage and newly formed this cartilage. So then it will become little bit harder. It is not that much hard as a bone. Okay, so this is known as callus bone formation. Okay, this E in this case. Okay, where you will have this osteoid extracellular matrix as well as matrix mineralization. Means along with this, you will have this mineral and this mineralization mainly of the calcium deposits and all these things, and this osteoid extracellular matrix and all, and they will become this callus formation. Okay, soft callus and hard callus. Initially, it used to be soft. Then later on, it used to become hard. As well as, I mean, means when deposition of the calcium is more. Okay, this mineralization and the bony tissue transformation from the, I mean, this fibrous connective tissue to the osteoid tissue, then mineralization with calcium salt deposition and all these things deposits, then it will become harder day by day. Till a bone, and this finally means what will have that, and this it will become a bony tissue. So this bony formation and the remodeling means the earlier and this shape of the bone means it will return back and it will become, I mean, this little bit normal, not exactly, I mean, hard or the, I mean, this occurs a little bit, I mean, this softness, I mean, this weaker will be there for the time I'm being, and for some more, and this days and months even. Then means you have to go for taking, I'm just more proper, I'm this diet containing the calcium, vitamin D, phosphorus, and all this thing. Then only, I mean, this the normal, I mean, this hardness and the as the normal type of this bone will become bone. I mean, so finally, this bone formation and the remodeling occurs. Okay, so these are the different subsequent events which occur during the process of bone healing. So this is important for your examination. Okay, just a minute. Some students are still waiting or what? No. And there are some factors which disturbs or interfere with the healing of this bone fracture. Means those are non-alignment of the two ends of the bone. Means when the two ends of the bone are not aligned, not properly aligned, then it will interfere your healing process. Then if there is infections, means from the environment, outside environment, even through, I mean, hematogenous route and all, so your body, I mean, the bone fragmented region or site is infected. So this infection will interfere the process, healing process. Then third is deficiency of calcium, phosphorus, vitamin D, as well as proteins. In the deficient, that means when all these, I mean, these are deficient, then your healing process will be later and this delayed and it will be interfered. Then presence of foreign bodies. Maybe some, I mean, these foreign bodies like stone or and this even these bone fragments or some other infectious agent or this foreign body substances, like as in case of this accident, automobile accidents and all these things, dust particle or some dirt and this and the stone or any other thing. So these are not the normal and this substances to be there, I mean, in those, I mean, this body tissue and at the site. So these are considered as foreign bodies. If anything, such kind of these foreign bodies are present at the site of the fracture, then means it will interfere. Then fragments of the necrotic bone, as I have already mentioned, some bone may be fragmented into pieces. Okay, necros, I mean, this bone. So if it is not removed out, then it will also interfere the process. Then inadequate immobilization. Okay, means when you know, plaster of Paris and all this means the part, and when you have these fractures in your leg and or like this limb and all this leg, hands and all. So we used to go for, sir, I mean, this plastering. Okay, for immobilization, you should not move it. Means it should be stabilized. I mean, this. Okay, you should not move. So that, I mean, this the healing process will be sooner and it will take up more properly. Okay, so if immobilization of the fragmented area site is not properly maintained, then it will also interfere the healing process. Then next is senility, all age. You know, I mean, in all aged people and animals, of course. Healing, I mean, this all the metabolic processes start, and this is not, I mean, this proper, and the catabolism starts and all. So that's why even hormonal and everything, I mean, the physiologically also, anatomically, biochemical also. So all these things used to be, I mean, this delayed or and this slow. So that's why all age is, or senility means all age is also a factor. Then lastly, pathological. means any disease condition, okay, of the bone, like maybe you have, osteodystrophy, or some, this cancerous bone cancer, for example, or any other, this bone related and this disease condition. This is just nearby, this bone fracture site, if disease condition is there. So pathologically means if it is not, this curing, it will disturb and it will interfere the process of your bone healing, right? Then next is, next pathological condition of the skeletal system is about spondylitis, and this also have hard. I think people used to have lumbar spondylitis, cervical spondylitis, and all this thing, right? So when means we are talking about this spondylitis, it is nothing but it is the inflammation of the vertebrae. Okay, where the vertebrae, the vertebra, cervical, then this thoracic, and this lumbar, and all these things, right? Then sacral. So this way vertebral and this bone vertebra. So when the reaction in this vertebra, okay, then it is known as spondylitis. So according to different parts, means different names: cervical spondylitis, lumbar spondylitis, and all this, right? Then what happened is that there has to be causation in between this vertebrae, and intraosseous abscess formation means within the vertebrae. Abscess formation may also be there, or granulomatous inflammatory reaction, some lesions, as well as fibrosis may occur in between this vertebra or within the this vertebra also. Like, okay, so mostly in case of these animals, Brucella abortus, Brucella ovis, Brucella melitensis, Actinomyces bovis, and this Coccidioidomyces species. So these are some of the these common organisms whenever infection used to be there in the vertebra and all. So you may have the problem of this spondylitis, or of course, some other and this technique, and physically also, like so far as this human, or even in animals also, suddenly fall down on the ground, or accidental accidents and all these things, right? Automobile accidents also, like, then means you may have this problem of this spondylitis physically. Okay, this inflammatory reaction of the vertebrae. So if you see the growth changes, there may be intraosseous abscess, means within the this bone, this vertebra, abscess formation, or there may be granuloma formation, which used to be normally encapsulated, means covered by very hard fibrous connective tissue involving one or two adjacent vertebrae, means it may involve the adjacent two vertebrae or more, and this vertebrae may be inverted, and there may be local enlargement of the bone, that very particular part of the vertebrae, maybe in the cervical area, maybe in the thorax, maybe in the lumbar. Okay, so that part used to be surely enlarged, and you will have, of course, very much painful, and you cannot utilize, you cannot move, and the stiffness and all these things here. Sometimes even when you are trying to bend down and this go on and this is standing for a prolonged this time and all these things, you may have a problem when your vertebra is having such kind of this inflammatory reaction, what we call spondylitis, right? So these are some of the pictures showing this lumbar vertebra, showing the ventral type of this spondylitis. See, okay, these are the vertebrae. Then here, okay, inflammatory reaction, and this also, see, some abscess is formed inside the bone, this vertebral bone. Okay, so there are three different type of this spondylitis. Commonly, those are cervical spondylitis, particularly involving the neck. The very much painful neck people used to have in this cervical, this spine used to be very much pain, and having this type of this spondylitis, what we call cervical spondylitis. And even the pain may be spread throughout the rear side of the back and the neck, both sides of the shoulder, even the collarbones and the shoulder joints. That much of this pain you may have when you are having this cervical spondylitis, and it may even restrict your neck movement, and the arms become motionless due to weakness in the muscles. Okay, such type of this, this painful, you may have, this in case of cervical spondylitis. Then lumbar spondylitis in the lumbar region, back region. Okay, very much painful, this also, when you are standing for a prolonged period, and when you are trying to bend down or lift some this weight and all this thing, that means you will have problem very much painful on this lumbar region back. Okay, so lumbar spondylitis, when the this lumbar vertebra are affected and showing this inflammatory reaction. Then third one is ankylosing spondylitis. This is also known as spondylitis deformans, and the condition, this disease condition affects the sacroiliac joints, vertebral column, the shoulders, as well as the hip joints. Okay, this is multiple and this complicated type. Okay, so this kind is the spondylitis is known as ankylosing spondylitis, and in this case the spine usually becomes very much rigid and very much stiff and painful. Okay, and you will have the knees, heels, hips, shoulders, neck, even the this jaw, this jaws, your jaw and all this is becoming very stiff. Okay, very much rigid and stiff, and even this painful, right? So these are about this spondylitis, and these are some more pictures about the this spondylitis of different kinds. And one of the very this typical this thing, and so far your this lumbar, or maybe means any this cervical, this thoracic region, or the lumbar also like spondylitis. So when you see anatomically, when you see it under this properly and all, so in between these two vertebra there is to be a disc, what we call intervertebral disc. Okay, and in the disc, inside this there is to be this nucleus pulposus, a liquid, this portion. Okay, oily and this liquid. And when these two vertebrae, okay, are having this spondylitis problem, inflammatory reaction, it will give compression on this intervertebral discs, and it will be protruded out. And after protrusion of this rupture or the this intervertebral disc, which has been protruded out because of the spondylitis, it will give pressure to the this nerve. Like you might have learned about sciatic nerve, brachial nerve, and all these things, right? So it will give pressure on this nerve, or even on the spine. Okay, spinal cord. So that will give you the pain. Mainly, this is pain is due to the pressure, compression given on the spinal cord, maybe on the other nerves like sciatic or brachial nerves. Yes, I am showing here also like this in different angle. Okay, so when herniation means this, intervertebral discs used to be herniated and protruded out. So that will give pressure on these nerves, like in the what to say, this medial portion of the legs from the lumbar region down to your heel. When people used to suffer from sciatica, you might have heard sciatic nerve, this pain, sciatica. Okay. So that used to be mainly due to the protrusion of the, this intervertebral disc in the lumbar region, mainly L4, L5, and L5S1. Okay, and where the vertebrae are showing the this spondylitis inflammatory reaction, giving pressure to the the intervertebral disc, and the intervertebral disc used to be protruded out and given pressure on the nerves like sciatic nerve. Okay, so that will be giving very much painful sciatica, what we call sciatica. So this way, the region, as I'm showing here, this red and this indication. Okay, so in this very particular, the protrusion of the intervertebral disc is there, giving pressure on the spine. Okay, spine and cord. Then even on the other nerves like sciatic nerves and all. So that will give you very much painful lumbar as well as your this leg. Even if it is, this having for a long period and all this, and sometimes you may have the problem of this even paralysis and all, right? Then lastly, arthritis, the inflammation of the joints. When we are talking about the skeletal system, so many joints are there. When the joints are inflamed, then it is known as arthritis. So it may be of different kind according to different this etiological agents, as well as the this exudate form and all, maybe Shearer's, Scrivener's type, purulent, or ankylosing type of these lesions also may be there in the joints. Okay, And mostly some etiological agents when we are talking about, this some bacterial organisms like E. coli, then Escherichia, and this in case of this swine and this rhizopathy, then Streptococcus, Shigella, then Corynebacterium ovis, Brucella, Mycoplasma, these organisms like Mycoides and Synovium, then some virus these agents like reovirus. Okay, then antigen antibody complexes formation. Okay, and this traumatic injuries also, like as in case of this trauma or injury or automobile accident, joints may be affected, and this may show in the inflammatory condition. So this very common, this type of this inflammatory reaction of the joints when we are talking about the hip joint means, okay, so that is known as coccygitis, and when the staple joint is inflamed, then it is known as gonitis. Okay, so I'm just showing this, these two pictures. One is normal here. Okay, this is the two ends of the bone, long bones, then joint area. So if it is inflamed, then it is known as arthritis. And when the, this involvement of the, this surrounding, this tissue, the covering and all these things, okay, the synovial membrane and all these things, then it is more painful and more critical. Then it is known as rheumatoid arthritis. Two different things you will come across: osteoarthritis and rheumatoid arthritis. Osteoarthritis, in that case, there is no any involvement of the synovial membrane, this covering. Okay, and when in case of this rheumatoid arthritis, the synovial membrane also used to get inflamed, and it is more complicated and more serious type. Okay, this way. And these are the gross lesions, different type of these lesions, like automatically the joints will be very much swollen with increase in the synovial fluid in that in that area. Then it will be very much this part will be very much difficult in movement, because of the joint is inflamed and showing this swollen and very much painful and all right. So movement will be very much difficult. And in case of this chronic cases, the fusion of two bony processes without leaving any joint, they may be, this totally joined up together without leaving any gap. Okay, in between this, that is known as ankylosing type. Or there may be, this diminish or reduction in the synovial fluid in between the this joint, and it may become very much dirty or thick in chronic cases. Okay. So this way means you may come across, this arthritis in different, this type of this lesions, and these are some more, this picture showing, this pictures of normal and then arthritis problems. Okay, like this. These are all, this different type of this picture collected from different sources. So please go through it, and that's all for about, this skeletal and musculoskeletal system. Okay, so little bit, about the nervous system I will give you, and in the next class I will complete it. Today I will just give you some, just development anomalies or development deformities, that is about the nervous system. Okay, so there are some, this different these types of these anomalies you may come across. Okay, so many of the noxious agents during the this fetal life, it is affecting the fetus. So, like during the first trimester of the pregnancy, during the first pregnancy period and all these things. So there may be agenesis or aplasia of some this organ, like we are talking about brain, means that is not developed, for example, or if it is this developed but it is not properly developed, hypoplastic condition, or even dysplasia in this disarrangement, or malformation of this central nervous system. It is, of course, it is not that much common as compared to other animals in the, so far domestic animals are concerned. Of course, it may be there. Okay, and it may be inherited or acquired, means it may be inherited from the mother to the offspring through this placenta, or sometimes due to infection after birth, like acquired, it may be. So this way means you may sometimes come across condition, absence of the brain, or like cerebellar this hypoplasia. The cerebellum is not properly grown up, it is showing hypoplastic condition. Okay, this way means you may come across. Then when the absence of the totally, I mean this absence of the entire brain is there, okay, means there is no any brain development, then it is known as anencephaly. Then amylaria, that is total absence of the spinal cord. Okay, so when brain is not there, automatically it used to, the animal also doesn't develop and have this, I mean, spinal cord. So it used to be always, I mean, associated with anencephaly. Then encephalocele, that is protrusion of the brain, like this as I am showing here, along with the meninges through a defect in the cranium, means the cranium bone, it is having defect. Then this brain tissue along with the meninges used to be protruded out, coming out of the brain. Okay, so that is known as anencephaly. And in this case, the skin forms a hernia shape and like this structure. The outer, this skin will form a hernia like this shape outside this skull. Okay, then meningocele, that is protrusion of the meninges through a defect in the cranium. When we are talking about the meninges only, not the just brain. Okay, so these are some of the pictures of this canine, this meningoencephalocele. Then, I mean, this next is hydranencephaly, that is complete or almost complete absence of the cerebral hemisphere in the normal cranium. Okay, means maybe completely or almost complete absence of the cerebral and this hemisphere in the skull, in the cranium, like this. See, okay, and the this leptomeninges form sac. The meninges, leptomeninges, means they used to form a sac like this structure enclosing cerebrospinal fluid. Means the cerebrospinal fluid used to be accumulated and it used to be enclosed by a sac-like structure formed by the leptomeninges. Whereas the cerebral hemisphere is not there. It is not, I mean, this completely or means almost completely absent. Okay, so it may occur in all the species of animals, but it occurs most commonly in case of these young calves associated with cerebellar hypoplasia. And this kind of this defect has been observed in case of the lamb also, okay, which has been vaccinated during the pregnancy for blue tongue. I mean, one disease, viral disease, blue tongue. In that case, I mean, this, if the mother is given this vaccination during the pregnancy period, so the fetus which is born and this, I mean, when it is born alive, then the lamb may show the presence and having the problem of this. Okay. Then sphingomyelin, this sphingomyelin, that is tubular cavitation of the spinal cord. Okay, means in a tubular form. I mean this. Then hydromyelia or syringohydromyelia. This, in this case, there is to be simple dilatation of the central canal of the spinal cord and the cavity where the, I mean, this spinal cord used to be there. So that cavity used to be connected with the central canal, as well as it used to be lined up by the ependymal cells. Okay, and it may cause progressive ataxia, paresis, scoliosis, as well as spinal cord pain. I mean, very much painful spine. Okay, then next is dicephalus, means two brains are present, means instead of one. Okay, in normal, means there is development of two brains, double brain, then it is known as dicephalus. Okay. Then hydrocephalus. Hydrocephalus is when there is accumulation, excessive accumulation of clear fluid, maybe of your cerebrospinal fluid in the cranial cavity, giving out very much bulging out of your cranium. Even from outside also you can see that it is here. You just see the head is too much big and swollen. I mean, and if you make the section, this cross section and also, or this longitudinal section also, then you can feel, you can see that the accumulation, excessive amount of accumulation of clear fluid or the spinal, the cerebrospinal fluid in the cranial cavity. Okay, So this condition is known as hydrocephalus. So it may be also congenital or acquired, means it may be inherited from the mother to the offspring during the fetal life, or once it is born, the newly born animal, due to this infection, okay, some infection, then it may have this problem also. So in case of this internal hydrocephalus, the fluid used to be within the ventricular system, and whereas in case of this external type of this hydrocephalus, the fluid used to be in the subarachnoid space. Okay, and the congenital type of this hydrocephalus is most commonly observed as in case of this young pup, young foals, calves, as well as piglets. Okay, and when we are talking about the acquired type of this hydrocephalus, so it used to be usually less severe than the congenital defect. Congenital one is more difficult and more severe. Okay, so the causes may be almost always obstructive, means obstructive type of this, mainly like, from the, this cranium, from that, this spinal cord should be going out towards the, this spinal cord and all these things. But when there is some obstruction, okay, so it will be accumulated more and more inside the cranium, right? So this, there may be parenchymal atrophy affecting more commonly this commonly the white matter as well as the cerebral cortices, means that may affect and this white matter as well as the cerebral this cortices, cortex. Okay, and this kind of this abnormal accumulation of this clear fluid, what we call, mainly due to the cerebrospinal fluid occurs, and what we call this hydrocephalus in the ventricle or maybe in the subarachnoid space and all. So it may be developed due to the obstruction in the drainage of this, this cerebrospinal fluid, or maybe as in case of this neonatal coughs due to influenza or parainfluenza virus infections leading to congenital hydrocephalus. When the mother is infected, okay, by this virus, influenza, parainfluenza virus, and that is, this transmitted, inherited, this transplanted towards the fetus, and when this calf is born, so that may have this problem, congenital hydrocephalus, or nutritional deficiencies like vitamin A, folic acid, vitamin B12, niacin, and even zinc may also cause such kind of this hydrocephalus. So these are some of the pictures of hydrocephalus, even in humans also. So normally the skull and the cranium bone used to be enlarged and showing the head, very big head type, because of this excessive accumulation of this cerebrospinal fluid or a clear fluid inside the cranium, what we call hydrocephalus. Okay, then cerebellar hypoplasia. This is nothing but due to the bovine virus diarrhea and this infection, or sometimes Hog cholera or feline panleukopenia virus. So cerebellum used to be this showing hypoplastic changes. Then anencephaly, as we have already learned, absence of brain. Then microencephaly means small size of the brain. Then craniokisis is the failure of the cranium to fuse. When this cranium bones, the fusion is not proper. Okay, so it is known as craniokisis. Okay, so it may result in hernia of the meninges, known as meningocele, or there may be hernia of the meninges as well as the brain, what we call meningoencephalocele. So these are some of the pictures of this craniokisis. Okay, means there is no complete fusion of the cranium and this cranium bone. Okay, like this. Then next is spina bifida. So in case of this young and this babies and young growing children also, it may happen. It used to be this having this problem. So it is nothing but a congenital defect in the walls of the spinal canal. When we are talking about the spinal canal, okay. So when there is a defect in the walls of the spinal canal, so which may be caused by the incomplete closure of the embryonic neural tubes, or there may be lack of union between the laminae of the vertebra, as I'm showing here. Okay, so that may show a defect in the walls of this cranium, and in this case, the spinal cord may herniate. This spinal cord may be herniated, may be coming out protruded. Through this defect. And these things and this type of these conditions, okay, I mean deformities has been reported as in case of this cattle, dogs, and sheep, so far animals are concerned. And there may be dysfunction of the tail as well as the anus. There may be incontinence and sometimes some pelvic limb weakness in those affected animals, or in those animals having this problem, or even in case of this human also, right? Okay, then this condition, spina bifida, can also accompany some other conditions like known as sacrocaudal dysgenesis, which is normally inherited as an autosomal dominant trait in case of this cat. Okay, so this is the picture of this sacrocaudal dysgenesis. Okay, this sacrocaudal portion, I mean of this cranium or the spinal cord, means that is not totally and just properly formed or developed, or if it is formed also defective, and this arrangement used to be dysgenesis. Okay, so these are showing this, on this defective closure of the bony encasement of the spinal cord, leading to this very particular condition, what called spina bifida. And in case of this young growing children, when having this problem, so they used to have back and this painful back, and then they may have the problem and this this lifting of this weight and all these things, right? So up to this, inflammation of the nervous system and others, some diseases, associated with this nervous system. So we'll discuss in the next class, and I will complete this system in the next class. For today, that's all. Up to this only. Okay. Okay then.